my whole purpose for being here is not just the treatment, but it's to explain and teach that patient how to stay out of pain or how to prevent injury. It's kind of that old adage from the Bible, you give a man a fish, you feed him for a day, you teach a man to fish, you feed him for life. But we've kind of accepted that philosophy in our practice, and we do our very, very best with every single patient to teach them not only about their body, but about their injury. I mean, after all, they're the expert, not me. They're the expert on how they feel. They're the expert on how they felt and how they want to feel. So we ask that expert, and we encourage patient participation. We actually want the patient to be as involved in their care as possible. I want my patients to challenge me with questions. I want them to challenge me to say not what I'm doing or question me, but question the injury or question the treatment. Because in the end, what we find is when a patient understands what's wrong, what they can do to prevent it, they're happy and they're successful. It kind of is a, if you will, it's a way of me hedging my bet a little bit, not to use a Las Vegas term, but I'm hedging my bet a little bit by putting the responsibility back on the client or the patient. It's their issue. I mean, I'm here to be able to provide them with the treatment, and it's mandatory that I must provide them with the education. And by doing so, and it isn't just so much about their injury. In our facility, we teach them about anti-aging. We teach them about weight loss, nutrition. I mean, all of these things play a vital and crucial role in the success of the treatment. So when a patient comes in, if they're not too sure of what foods they should be eating, we can do a food sensitivity test on them to make sure they're not ingesting or eating something that's creating inflammation. We can also be able to teach them not only how to treat the injury from rehabilitation, but we provide personal training so that way they can lose some weight or they can function a little bit better or encourage cardiovascular improvement. So in our facility, our true philosophy is look at the whole patient and fix that.